Good afternoon, everyone. This is Ann Cuppinger. I want to welcome you to the Family Peer Support Services Information and Listening Session. We see a lot of people still getting online, so we're going to give them a couple minutes, and we'll be right back. All right, welcome everyone, and thank you so much for joining us. And we're really excited to have this opportunity to speak with all of you. I'm Ann Cuppinger, and I know most of you, and I'm really glad to see so many people who I know will have great ideas to share with us today on the line. Some of you know me from my previous role doing work with Families Together, coordinating the training and credentialing work there. And I'm now a part of the Community Technical Assistance team where, among other things, I'm going to coordinate with Jerry Burton some of the activities that we're going to do with family support programs. So I want to give Jerry a chance to introduce herself as well.
Hi, everyone. Good afternoon. Again, thanks for taking out the time to be with us this afternoon. Geraldine Jerry Burton. And I'm working alongside with Ann. We're working together in partnership on the family support side of transitioning. And we look forward to continuing to work with you and your participation in what we have to offer.
We have a nice-sized group today, and by that I mean that it's small enough that we can let everybody introduce themselves so we know who you are and what kind of work you're doing. So I have some of those names in front of me. Not everybody shows up on my screen. So I'm going to kind of go around and invite you to introduce yourself. Before I do that, though, I want to give you some technical guidelines for the webinar. First of all, if you are listening on your computer, that's fine, but we can't hear you talk. So if you want to be able to participate in the conversation, I recommend that you call in using the phone line. And if you're not sure what the number is, if you look at the elephant and go over above the elephant to your left, you'll see a tab called Event Info. And in that tab is a phone number that you can call to connect to the webinar phone call portion of the webinar, so we can hear you. If you're not able to call in by phone, certainly you can participate by typing in the chat box, and we'll try to keep an eye on that chat box so we can share your comments with the group. The way you get to the chat box is over on your right. You'll see a little bubble that says chat under it. And if you click on that, a chat box will pop up down in the bottom, and there's a send to. You'll see it says send to, and you can open that drop-down menu, and you can send to all attendees, and then if you type in there, everyone will be able to see what you have to say, and we can respond to you. So the other thing I would ask you to do, since we're going to leave the phone lines open, is to mute your phone when you're not talking. And also, don't put us on hold, because otherwise we will end up hearing your organization's hold music. But we really want to strongly encourage you to really speak up, because this webinar is really designed to be interactive, and we are looking forward to hearing your ideas. So if you can call in, that would be great. So before we get into the content of the webinar, maybe we could just go around and do some introductions. And I see Lydia is on the phone. Lydia, can you introduce yourself?
Hello? Hello?
Hi, Lydia. We hear you.
Can you hear me?
I can.
Hello?
We can hear you. Yeah.
Good. So, hi. How are you?
Good.
All right. Yes, I am a parent, by the way.
Yeah, I saw that.
I'm Lydia Edelhaus. I'm the Director of Family Support and Advocacy Services at MHA in Dutchess County.
Terrific. Thank you. And Lydia is also a member of a Family Peer Advocate Advisory Group that's helping us take a look at some of the training and credentialing work that we're doing. Ruth Fennelly, can you introduce yourself? Ruth is looking for the phone number. Brianna, maybe you can send Ruth the phone number. We'll come back to Ruth. Marianne, are you able to take us off mute and introduce yourself? How about Erica Leonard? I wonder if maybe people are, is there anyone else that can hear me on the phone who's actually on the phone and wants to say hello and let us know that you're there?
Ann, hi, you have the Hudson River Field office here. Now, you know in the event info there's no telephone number there? It's just the provider number or whatever it is, the event number, but there's no 800.
Oh, that's interesting because normally there is. Let me copy this and stick it in the chat box right now.
Sounds like
so that
it is in the chat
no, that's
box,
my.
Oh wait.
Hang on a second. Actually, I shouldn't probably put that in there because then you'll be me. Brianna, can you send people a number that they can use to call in? Here we go. Right. Brianna's just posted the number up.
All right.
So that you can call in. Sorry about that. It's funny. I can see it in mine, so I'm surprised you can't see it in yours.
Right.
So who's there from the Hudson River Field office?
You have Tara, Lucinda, Lori, and Barbara.
Oh, terrific.
Fabulous.
That's great. Is anybody else able to introduce themselves?
Hi, Ann. This is Heather.
Hi, Heather.
Hi, Ann.
Hello.
For those of you who might not know, that's Heather Lane from the Office of Mental Health, who's the coordinator of the Family Peer Support and Youth Peer Support Initiatives for OMH, and a big fan of all of your work. All right. Well, as you guys have an opportunity to speak later on, you can say your name and tell us where you're from, and we'll just go ahead with the webinar while people are getting on the phone. Sorry about that the number wasn't available to you there when you signed in. Okay, so with that, we'll move ahead. And Jerry, I'm going to
sorry.
give you the baton here.
Okay, thank you.
All right.
Again, welcome to everyone, and this is our agenda for the next hour and a half. We're going to do an overview of Seatac, which is the Community Technical Assistance Center, and MCTAC, which is the Managed Care Technical Assistance Center. We will also discuss challenges and opportunities for family peer support services. We have a series of discussion questions. We will talk about next steps, and we will have a Q&A. But the main thing we want to hear about is what you are doing. We definitely want to hear from you, and so that is one of our main objectives as well. So moving forward, we have a poll question. Our first poll question is, which best describes your employer? Please give us an idea of the agency you are employed by. And I hope everyone can see this. Put in your answers. It's going to take a while for the answers to show up. And while we're waiting for everyone to plug in their answers, we just want to let you know that New York is very fortunate to have many different types of family peer support service programs. And at Seatac, we are really excited to support all of this work. And each region, as we know, has a different makeup of programs with a mixture of independent programs, programs housed within an agency that provides many services, as well as embedded advocates working in hospitals, residential treatment facilities, and CRs, as well as clinics and waiver programs. So, okay, here's the result of our poll. One person said Children's Mental Health Provider Agency, 2 other community organizations, 1 other organization type, and 5 didn't answer. So for those of you who said answer to other community organizations, could you share with me what they are, if at all possible? Share with us that information. Okay, let's see. And one person did other organization type.
That was us, because it's the state.
That was what? I'm sorry.
This is the Hudson River Field office. We work for the state, so the other organization type.
Okay, thank you.
Sure.
All right. And what about the other community organization?
Hello.
Yes.
This is Mary Ann. I was finally able to get on the call. I apologize for not.
That's quite all right.
How do I get rid of the background noise from the computer if I'm going to be on the phone?
Put yourself on mute.
Well, no, she needs to talk. So can you put the sound off button on your computer?
Right.
I don't know if I can do that. Okay. Can you still hear me?
Yes.
Okay. All right. I apologize.
No, you're fine. It takes a little while till everyone gets comfortable with the technology.
It does. It does. All right. So thank you for everyone who participated in our poll question, and we're going to move on. So Seatac and MCTAC, we have a series of partners, and we are partnering with a number of organizations, as you can see from our slide, to provide you with the best consultation and technical assistance. And the staff of MCTAC and Seatac, as well as these partners, believe in the importance of relevance of peer services, including family peer support services. However, our most important partner is none other than you. We really value what you have to say, and I'm quite sure with all the changes that are going on, you kind of feel a bit like this. I don't know about you, but I think that a lot of us feel this way. And the thing that's going to make it work is leadership, teamwork, looking downstream, balance, breathing, helpful guides, and hard work. And so Seatac and MCTAC look forward to providing you with timely, helpful information to help you navigate your own path to success. So what is MCTAC and what is MCTAC's goal? MCTAC is partnering with OASIS and OMH to provide foundational information to prepare providers for managed care support and capacity building for providers. And some of the ways that we're doing that is through tools, group consultation, informational training, and using assessment measures. And the information and training on the critical domain areas necessary for managed care readiness. And we're also going to use aggregated feedback to providers and state authorities as well. But one of the main overall goals is to achieve the overall goal of preparing and assisting providers with the transition to Medicaid managed care is by providing training and intensive support on quality improvement strategies, including business, organizational, and clinical practices. These things are very important in order for us to move forward with the changes that are going to be happening. So what is Seatac? Seatac is funded by the New York State Office of Mental Health, and it began in 2011, initially focusing on children's mental health clinics and then expanding to all Article 31 clinics. So now we expand the offerings to the full array of children's mental health programs in the state, including but not limited to RTFs, CRs, day treatment, home and community-based waiver programs, clinics, and family support. And our goal is to provide training, again, consultation and educational resources to mental health agencies with the goal of improving outcomes for families, adults, and children, and with a focus on supporting agencies to integrate both efficient business practices and effective clinical practices. Seatac has reached close to 400 agencies with over 300 offerings in areas such as financial management, revenue maximization, engagement best practices, and clinical decision-making. So it's important that we are doing this right now. And for this year, Seatac will be offering a variety of trainings in line with the vision of providing the right services at the right time and in the right amount. So what can you do to make the most of Seatac and the MCTAC support? This is definitely a group project, and in order to be successful, networking within and outside of the community of FPSS providers is very important for information and ideas. If you are a small provider, involve and possibly expand your board. You have to include them. Network with other small providers in your region. Look for the right expertise to complement what you have. Your organizations, especially if it does not currently bill Medicaid, will have some important decisions to make about how to develop or partner with others to have the infrastructure needed to bill Medicaid. MCTAC can help you to understand what is needed so you can make the best choices for your agencies and the people it serves. If you are an FPSS program within a larger provider agency, be smart about how to manage your program and look for opportunities to be at the table as the larger agency is planning for this transition. If you have been operating largely as a satellite, look for ways you can partner and add value to the other services provided by your agency. All of these are very important, especially about being at the table and partnering with others as well. So this is our second poll question. Please let us know whether you have participated in a Seatac event in the past. I would ask that everybody take part in our poll. Give us a few minutes. So the Seatac and MCTAC webinars, learning communities, and in-person events are usually open to providers of all types, adult, child, and a wide range of professionals, all working toward the same goal of improved outcomes for children and families. When a webinar or workshops is announced, we try to provide you with some guidance as to who the target audience is so you can make a determination about what will be most helpful. Having said that, much of the programming for Seatac and MCTAC cut across audiences, so take a broad view of what might be relevant, and we can encourage you to sign up for the Seatac and MCTAC listservs and think about how the Seatac and MCTAC programming can fit into your organization's professional development program. Okay, so we have answers to our poll questions. Okay. One person said they have participated in 1 or 2. Someone else, I have participated in 3 or more, 3 people. And one said, I have participated in many Seatac, MCTAC offerings, and we had 5 that did not give us an answer. Okay, well, for those, okay. No one said first time. Okay, all right. Very good, excellent. Very good. Thank you for your participation in the poll question. So I'm going to turn it over to Ann now, I believe. Ann?
Thanks, Jerry. Thank you so much. So the next, I really want to underscore what Jerry just said, which is that there's a lot of Seatac activity going on. There's 2 websites, there's lots of announcements, and it comes at you from various listservs that you might be a part of. Families Together, NIAPers promote the Seatac activities. And what we're hearing from people is that they're not always sure whether a particular offering is relevant to them as a family support program. So feel free to reach out and ask if you see something and you wonder. My general advice to people is to err on the side of participation if you're not sure. Because there are things that you need to be aware of, especially if you're a smaller provider organization that doesn't have a, either isn't doing any Medicaid billing right now, or doesn't do a lot of Medicaid billing, or maybe only participates by way of a waiver contract, there are a lot of things that may not look like something that you would normally pay attention to, but that may be relevant to you. So if you have questions like that, reach out and we can help you decide if that's something that would make sense for you to participate in. You're going to see, the focus right now has been very much on adults with the MCTAC offerings, because the adult transition is happening before the kids transition, and you're going to see more and more activities that are specifically targeted to children's providers, although we've had a lot of participation from children's providers so far in those events. A lot of what MCTAC and Seatac do is recorded, so including some of the live sessions, there are video recordings that are made. So do check out the websites, because if you missed something, there's an opportunity for you to take a look at it online. So the next thing I want to talk to you about, the next couple slides really come from a presentation that the state has done about what the goal of all of this transformation is about. And I wanted to include them because I think it's important for family support providers to understand that the intention is to really invest in services like family support, and to try to get services to kids and families sooner, and hopefully provide more in-home services, be more family-driven, and work to keep children at home and invest in their families, and help the families get connected to the communities to hopefully provide a level of intensity and support that helps kids stay out of higher levels of care that, really we'd like to see if we can meet their needs before they get to that point. Or provide them with, the right kind of support when they need that higher level of care to help them stay connected to their families and return home and back to school as soon as possible. So I consider that a really good sign. And as part of that, the state is submitting an amendment to the Center for Medicaid Services, and they're adding some new services as state plan services. And state plan Medicaid services are the services that are most broadly available. So unlike waiver services where you need to meet, sort of high levels of need before you're eligible for those services, the state plan services are available based on a determination of medical necessity. And one of those services is family peer support services. It's kind of, if you think of one of those pyramid models, it's really at the bottom of the pyramid. And the good news about that is that families should be able to access this service earlier, and because you can provide the service regardless of where the child is in their in the service system, they should be able to have some more continuity and stick with the same provider over time. There'll be a lot of factors that influence that, but I just think this really speaks to the state's priorities here, and one of those priorities is the work that you all do. This slide is really designed to give you an idea of some of the questions that are on our radar, that I know are questions I've heard from many of you. As we go through these, I want you to think of what I should add to this list. And many of these have to do with this transition to Medicaid managed care. We know that there are other training and technical assistance needs as well. So obviously, many people are concerned about what will happen with the quote-unquote 1650 money, the state aid money, and whether or not that will continue to flow. And really behind that concern is your desire to continue to work with families who aren't Medicaid eligible. So there are a number of changes. More families are eligible for Medicaid than before.
I fully understand that.
I think that the state is hearing that concern, but we don't yet have a concrete answer about what's going to happen with that money and what kind of percentage of that money will be able to be maintained. But it's something that we're tracking, and that I know the state shares your concern about continuing to be able to reach those families. People have questions around rates. and what the rate structure will look like. Again, we don't have information on that yet, and when we do, we can begin to help providers think through what that means in terms of how you budget and hire and think about how you provide family support services. I know on the adult side, for example, their billing is taking place in 15-minute increments, and there is some ability to bill for telephone contact with families. Again, we don't know what that's going to look like on the kids' side, but as we find that information out, we'll share it with you. Some of you are contract providers for waiver programs, and you experience sometimes big fluctuations in volume, and that can be difficult for you to plan for and absorb. And so, you're going to need to think about how to handle that as a provider, and hopefully, Seatac, through some of their guidance, can give you some thoughts about strategies for managing that. We also, know from what's happened in other states that sometimes family support services have to change some of the ways that they operate in order to fit in a managed care environment. You'll be having to seek authorization to provide the service. You'll need to be coordinating with other providers around how many services are provided in a given day. And you may find that you sometimes need to work in shorter time frames because you may have limited service authorizations or not. So this is the beginning of an ongoing conversation, and the good news is I think that the plans are very open to exploring with you what works. I guess I didn't realize until I got into this work how much of a conversation the plans are willing to have around various ways of doing business with the providers that they contract with. So you'll have to look at staff qualifications. The good news is that with the training and credentialing that we have, assuming that's approved by the Center for Medicaid Services, we have a mechanism for qualifying and credentialing family advocates, but you may be eligible to provide other services like respite. We have one program that's looking at providing family support to adults, the family members of adults. And there may be other kinds of services that your staff are qualified to provide, and that by, adopting these other lines of business, it may help you to sustain your program. Those of you who are small, I realize I have kind of two audiences here. Some of you are programs that are embedded within larger organizations. We have one program that's part of a hospital. We have someone on the line who's part of a children's behavioral health provider organization, somebody is in an MHA, and then we have some independent small providers that are part of community organizations that may not have a history billing Medicaid. We realize that each of you have different needs, and that the small providers are wondering what it will take for them to be successful as a contractor with managed care, and do they have, and what are the necessary infrastructure pieces that they need to have in place. And, Seatac is doing some of this work with the adult providers now, and some family folks have participated in those workshops, and they'll be repeated for family providers as well. And then, lots of questions around preparing staff to handle the various mechanisms and paperwork and approval processes associated with Medicaid. So the phone lines are open. What other questions of this sort would you like to make sure that we have on our radar? That's enough questions, apparently, for now. If we can get those answered, then we'll be in a better place. I also really want to make sure that I characterize this as a time of opportunity as well, and those of you who know me know that I wouldn't say it if I didn't believe it, but I do think that while there is a lot of change, and certainly family support is, some of the smaller organizations are vulnerable, I think that this is a time of opportunity for family support too. And we have a very versatile workforce, and I think if people really look at various partnerships that they might be able to form, new partnerships with new referral sources and working with families from systems that you may not have worked with in the past, there really is an opportunity to grow family support and even to diversify your funding in a way that really strengthens your organization. And I think for those of you who are part of larger provider organizations, those same things are true. You'll have to work, obviously, within your agency to make that happen. But also, we know there's a lot of embedded programs that really don't interact that much with the different programs in their own agency. And I think you will see that as they try to meet their objectives, they will also be more interested in partnering with you. And, with that, perhaps the size and capacity within your program can increase. So I think that it's, the trick here is going to be to preserve the character and spirit of family support while all of this is going on. And it's just going to require some thinking, some sharing amongst ourselves so that we can really learn from one another as we go through these changes, and hopefully be able to make this wonderful resource available to even more families. I think those of you who really understand the impact of all these changes on families are really also in an important position where you can participate in these conversations in your agency and in your community and really try to help people remember what the goal is here and keep their eye on the prize of navigating this transition and hopefully taking advantage of some of these changes to bring services and supports to families in a more flexible, community-based, earlier manner, which is what we all, want to do anyway. So we included this slide because we think you might find it interesting to think about where you are right now in your own reaction to all of this change. We see a lot of people like the fellow with the red circle around him sort of wondering, what is the impact going to be on me? And in this morning's call, somebody really asked for some technical assistance around helping families understand these changes. What can Seatac do to help them help families anticipate how the change will impact them? Which was a great suggestion. So we're hoping through our work with Seatac, some of which will include networking all of you and some of which will include other kinds of technical assistance and training to help stave off disillusionment so that your programs can be flexible and creative and do what you do best and move forward in a way that's productive and successful. So the next 6 or 7 slides really are questions that we hope will stimulate a conversation amongst the people on the call. So, and we will be, I know a couple of you may have had difficulties signing into the call itself, so we're going to be monitoring the chat box as well. So if you aren't able to speak directly, you can chat in your questions, but if you can talk, it works a little better. So one of the things that I feel very strongly about is we have a lot of really good things going on right here in New York, but we don't necessarily know what other people are doing. So I want you to disregard humility for a moment and think about what you do in your program that you're proud of. And it could be something very small, like we finally figured out how to get more referrals from someone, or we started a really great support group focused on adoptive parents that's going really well, or we are doing this new curriculum with families that we think is effective. Share with us a little bit what you are doing that you think is worth noting.
Oh, I'm not shy or humble. This is Lydia. Are you there?
Yeah, go ahead, Lydia.
Oh, okay. So you were just talking about some programs moving into adult family support, and I'm happy that we are doing that as well. I mean, it's pretty clear that we have to broaden our horizons, but we had started a young adults program a couple of years ago with some grant money, and it occurred to us last year that young adults have parents too. So we started a support group for the parents of, first of all, our young adult participants and members, but we're broadening it out to the community because there's a lot of people out there who have 18 to 25-year-old children who have, mental illness and have decided they're adults and are not going to take medicine anymore. And the parents are tearing their hair out. So that's something I'm really proud of.
Great. Thank you. And I've heard that from other people, so it would be interesting for us to think about, you know, even something as simple as having a phone call with the various people in the state who are looking at that to share some of their strategies with one another. Thanks. Other ideas?
Hi, this is Mary Ann.
Hi, Mary Ann.
We have a lot of services we provide. You know, we do the support groups and the parent trainings. We do teen life skills, respite, and we provide a lot of advocacy in the schools. And we are traveling all over the place to provide all the advocacy in the schools, so we're really busy doing that. And I feel like we provide a lot of support to families, and our staff are very, very empathetic and do a really good job providing all those services. Our respite program is fantastic. We have respite staff. The families so need the respite. And so I want to say I'm proud of everything we do.
Mm-hmm. And you guys cover an area that's, you know, rural, and I can imagine the mileage that you're putting on, right? Have you found any strategies that work really well when you have folks spread around like that, you know, things that are helping you cope with that distance?
Well, we have a couple of company cars. One was actually donated by the Office of Community Services, so that's helped us a lot. You know, we do mileage reimbursement for the staff that are using their own vehicles, but we have two company cars. So when we're going long distances, and some of the school districts we go to are an hour away from us. Yeah. I was at such a school this morning that was a really early CSE meeting that was an hour away. And then the mom needed a ride to her clinical appointment back here in Glen Falls, so I was able to do that. Went to the school meeting and then took mom to her clinical appointment, and then she had a ride back to her rural area. Yeah. So it is expensive. It's expensive to maintain our cars because we travel so much. So those are huge challenges. Yeah. And something that, you know, one of the things that we'll have to think through is, you know, moving from the kind of grant-funded environment that most of you are operating in right now to a billing environment is going to require some thinking about what's doable. So, you know, if you spend an hour driving and an hour driving back and only an hour face-to-face with the family, that's 3 hours of your time for which Medicaid's only going to reimburse you for 1 hour. So that's the kind of challenge we're going to have to think about, you know, how to handle that. And I think part of the answer, what we hear from other states, part of the answer is to make sure that you have multiple funding streams to help you just figure out ways to cover all of what you're doing, because some of what you're doing won't be Medicaid billable, and some of it will. So you're going to need a mix of funding streams. The other thing you mentioned is respite, and respite will end up being a service that's separate from family peer support services. And so you'll be wanting to keep track of, and this is something that we can track, you know, help you track too, what are the requirements for providers of respite services? Like historically, it's been kind of under the umbrella of something you would do as a family support provider. And you'll likely still be able to provide that service, but it'll be billed separately from family support. So that's great. Anybody else? Things that they're doing that you think are noteworthy, unique?
Hi, Ann. This is Erica.
Hi, Erica. Yeah.
Hi. Okay, there were a couple of things that came to mind when you brought up this question. And I think in our area, we all the agencies, not all, a lot of the agencies really collaborate and work together real nicely. And we all come to the table. Last year, we started having community meetings where we invited the schools and all the different agencies in Clan County. And we really got some good work done there, and it's continued. Another thing I'm really excited about is we're going to take the youth peer advocate through my program, and we're trying. So I'm actually excited about that and really happy to take that on.
Yeah, terrific. Thank you, Erica. One of the things that we're encouraging people to do now as something that you can do before all of this gets started in earnest in 2017 is to really look at other partners, referral sources for your program and people that you can partner with. Because, again, that's another way of diversifying the work that you do. So you maybe have different funding streams coming in. We have some programs that receive money, actual contracts from schools to do work with their programs, and hopefully they can share some of that with everyone kind of in a webinar format, so it's something you might be able to recommend to some of your schools. Other thoughts and comments? All right. Well, keep this question in mind, because I think no good idea is too small to share, and we'll think of different ways of doing that. Some of it may be through little profiles of what people are doing. We might be able to do some webinars, some focus groups and things like that. All right, so many of you supervise or work with family advocates who've been through the PEP training, and we're interested to know what the feedback that we've gotten on PEP so far is that generally it's a good training, and that it gives people a good starting point for working with families. But we know that as you watch the advocates work, you may be seeing skill areas, competency areas that we could do a better job in terms of either training that we do in PEP or other training that we develop. And we're wondering, what are those things that you would like to see additional training available for advocates?
And this is Ruth. Can you hear me?
Yeah. Oh, good. You made it on the phone, Ruth. Thanks.
I think one of the struggles, because I've been doing this for a long time, that I think is lacking all the way around is how to write an effective case summary, or however we're going to be calling it, especially if we're going to go to Medicaid billing. We have to make sure that our documentation is accurate. And so how to keep my personal I thought out of that, and stick to the facts only.
Yeah.
How to write a good whatever they're calling a progress note.
Right. Well, everything from how you write your goals in the larger treatment plan, all the way through how you document your work, and yeah, I think that we're hearing that. That's a great suggestion, and it's something that we can. It's one of those things we can do, web-based. It's a perfect thing to help people learn how to do in a web-based environment. One of the big changes for people will be that Medicaid notes have to be about the child, even though you're really working with the parents for the most part. You have to sort of write those goals and notes in a manner that makes sure to reference the child, because that's the person that Medicaid is paying attention to. And we've actually, we've had the experience, I've heard this from more than one program director, that they have really wonderful advocates, truly wonderful, gifted, talented advocates who cannot handle the paperwork. And so we need to figure out what kind of supports we can put in place to help people be able to do that, so that we don't lose good people over this technical issue. Because, of course, we didn't hire them because they were good at paperwork, but they do have to be able to do it. So I agree. Other skills for advocates that we need to be paying attention to?
Hi, this is Lydia. One of the things that I've been very focused on, off and on over the years, is the difference between advocacy and support. Support is one thing. Advocacy with other organizations is a whole other way of being, and I see that there's a pretty focused on a couple of modules on education advocacy, but it's not just knowing the law, it's also knowing how to present yourself and the parent that you're with, who the people are on the other side of the table, And it's not just schools, it's also social services, it's also hospitals. There's a whole lot of areas in which the family advocates in my department are doing very sort of serious advocacy. And I also think it's important to note the difference between advocacy and mediation, because some people think that advocacy and mediation are the same thing, and they're not. So that's something I'd like to see more of a focus on.
Yeah, that would be, I can see a really interesting, almost graphic, looking at advocacy, mediation, support, and maybe something else, I don't even know, you know, and the role of the family advocate. Yeah.
Yeah, yeah.
Yeah. You know, one of the things that people, a new way of thinking for family support providers in this new environment is to be thinking about how what you do helps other people accomplish their objectives. So both the managed care organization that you want to contract with you, how can you help them achieve their goals, or other providers who have their own you know, accountability standards. And one of the classic things that family support is able to offer is outreach and engagement help. So, you know, really helping to find families, to help families connect with the service, to try to clear away whatever barriers might be there for the family to keep coming back to service. And, you know, right now, some of you are thinking, you know, we don't need any more work right now, you know, but you're going to have to really, so the whole idea of outreach sometimes doesn't make sense. Like, I've got enough to do right now. I don't really need to go find more families. But I think if you think about, you will maybe need to do more of that in the future, and you'll definitely need to be thinking about how and articulating what value does family support add. And how can we not only help the family, obviously, accomplish their goals and objectives, but help you, other service provider, accomplish your goals and objectives as well. And that's, you know, that's part of all of that relationship building, too.
Ann, I just wanted to say that that's a really important point, especially with everything that's going on, I mean, now and in the past, but even in the future, because, I mean, I don't know about the people on the phone, but I know when I was doing direct services, and even now if I go somewhere and I'm, you know, speaking to families, and the amount of families who don't know about family, still now in 2015, still don't know about family support services, who to contact. Even at the Families Together conference, when I asked folks to raise their hands if this was the first time they had been there, the amount of people whose hands went up, you know, so again, we really have to, you know, do as much outreach as we can. And I know a lot of people don't like to, but again, it's important, especially even now.
Right. As families try to themselves absorb all of these changes.
Exactly, exactly.
Right. So somebody, Lydia posted a question about, are we going to be touching on children's health homes, or is that a whole other thing? And, of course, it is a whole other thing, but, you know, it's an important structure that is really going to impact how families experience the service system. Seatac is not, does not have sort of central responsibility for training care coordinators in health homes. But we are, you know, looking to see what's happening with health homes so that we can communicate more of that with all of you. And I think it is the first change that some of your families will experience. Some may not even really, it may be kind of seamless for them, and others it may require them to change care coordinators as health home implementation starts up in October. And certainly your advocates will need to understand how all the intricacies of health home enrollment and how the health home process works, and also how those plans of care are written, because you may be what they call downstream providers for the health home. So they may contract with you to provide some of the services that health home families are eligible for. So I see in our future some kind of a webinar on understanding the health home process. And then you'll have to be looking. Yeah, go ahead.
Could I ask one question that maybe you could keep in mind? I'm sorry, this is Lydia again. I didn't mean to interrupt you.
No,
but the one question I'd like to keep in mind is Right now, I'm working on behalf of my agency, writing up this HARP application, which is basically like waiver services for adults. And my understanding is that the agency has to be designated by Medicaid in order to be allowed to provide HARP services for adults. And my question is there a similar or concomitant designation process that has to happen for us in order for us to be able to provide these kinds of services for children? I haven't heard word one about it. So if you hear anything and you build up a webinar, please keep that question in mind.
Absolutely, absolutely. I've suddenly been, developing a long list of health home related questions, and that is one of them. My understanding is that yes, there will be a designation process, and we need to find out some more about that.
Okay, thanks.
And share that all with you. Other questions?
This is Ruth. Even though the health homes is a little bit further out, in July is when the big changes happen in waiver and the unbundling.
Yeah.
And I just wondered if, first off, I worry that unless you are a waiver provider, that information isn't being shared.
Mm-hmm.
So us as advocates are hearing it after some terrible, horrible changes happen without notice.
Yeah,
and,
okay.
The provider is making changes, and we're feeling it from the family end.
Mm-hmm. And how are you experiencing it from the family end?
They're moving their care coordinators around, and
right.
They have to restructure their programs for July,
mm-hmm.
and
right.
but they don't, they're just doing it, and families are being told, I have a family that's had 3 care coordinators in 2 months. Come on. These are our very fragile families.
Right. Yeah, we
anyway,
just heard
it's
about
just
that
frustrating
from
because nobody shares.
Mm-hmm.
Nobody shares why they're doing it. And then
mm-hmm.
until I really pressed and went above everyone's head and then was told it's because of the changes of the unbundling.
Yeah. Well, so very quickly for people on the phone, and then we probably should move on. What I'm hearing here is we need to find a couple people who can share with family advocates what's going on with, the transition right now in health homes and also the unbundling and waiver. So we'll see if we can get something organized, in sometime soon on that. What's happening, for those of you who may not be aware, is that there are some rules that the Center for Medicaid Service has promulgated that are designed to reduce conflict of interest. And I won't even attempt to try to explain all of the rules, but it means that the care coordination functions have to be separated from the service provision functions in the waiver. And so waiver programs are having to sometimes shift around who's doing what for families, and sometimes families are having to be moved to care coordination in another agency to try to reduce the conflict of interest in order to be in compliance with the Medicaid rules. So it's definitely a tumultuous time for those organizations, and as Ruth is pointing out, for some of the families who receive waiver care coordination. So we'll get you some more information on that. Anything else in terms of advocate skills? Keep this question in mind and let us know as you think of things, and we will try to be responsive to that. So supporting supervisors, we hear a lot about the fact that supervisors could use some training. Supervisors of family peer advocates, haven't necessarily been trained as supervisors. Some of them are clinical folks who don't really understand family support, because they haven't been a family advocate. And sometimes they are people that understand family support but really haven't had any training and supervision. So we are looking down the road to figure out if there's some training we can do with supervisors, but I'm interested in anyone's thoughts about what the need looks like.
I know it's been difficult for myself. This is Erica in Clinton County, because I supervise family support services. I'm the program coordinator, but my supervisor is very new to my agency and doesn't know anything about family support. So I'm trying to bring back all this information to her and explain it so she can go to those up above and make these changes that need to happen. And so sometimes it's been difficult to try to explain it to her and get the ball rolling here.
Okay. So what I'm hearing there is that it's not just the training for you as a supervisor, but the attention to the people above you, right? Yeah.
Yes.
Yeah.
See, my supervisor is the clinic supervisor.
Yeah. Yeah.
So so when she came, let's say it was last year, she didn't know anything about family support services. So she's learning as all these changes are coming down. And
yeah.
That's been a little bit frustrating.
Yeah. Okay. I'm sure you're not alone. And those relationships, so you're one of those programs where family support operates within a larger provider agency. So the whole Medicaid billing thing itself, the mechanics of that isn't going to be as heavy a lift for you as it might be for a community-based family support program. But you have to focus on how to help people within your agency really understand the work that you do and what kind of support you need to be able to do that work effectively, and how to help you partner differently with other programs within your agency. Yeah, so different set of issues. Anything else from the perspective of supervisors? All right. Another thing we've been hearing a lot about is, programs are interested in training that will equip them to deliver some different, parenting support programs. Some of them might be evidence-based, some may be, kind of quasi-evidence-based, but it's the kind of thing like common sense parenting, or some people have been trained in the 4 R's and 2 S's for multiple family groups. People are looking for strategies that they, kind of a curriculum that they can deliver that may help families build their capacity to meet the needs of their kids. So I'm curious about what kinds of things you're currently doing and how those are working from your perspective, from the family's perspective, and also are there any models that you're aware of that you're intrigued with or that you think would be interesting for us to explore as we look at what might be something helpful to bring to New York?
This is Ruth. I'm not saying this to, I want to be humble when I say this, but I'm trained in the EPIC, Common Sense, STEP, and 4 R's, 2 S's. And then I also at one time took how to talk to children so kids will listen, something to that effect. So there's been an awful lot in my 20 years of different trends or different, people have tried different parenting, hopped on that bandwagon or this bandwagon. Yeah. And I got to tell you that I always like common sense parenting because I like the group interaction and I kind of like the hands-on kind of practice stuff. And 4 R's, 2 S's does the same thing. The concern I have about any of these evidence-based is, like, I've done them so long that I kind of mix them and match them depending on my group. I may take a little of this one, a little of that one, so I'm no longer sticking to the fidelity of the program. But I recently was at a juvenile justice regional conference where they brought in the 17 counties, more the probation departments and social services. And the people that were there were talking about common sense parenting and not at all liking it. They said their parents don't like it. And I wondered, as they were talking about, because they were talking about finding a evidence base, and they were recommending EPIC. Every person influences a child, which I do like that one too. But I think it depends on who the instructor is.
Yeah.
Honestly, I was shocked that they would say that common sense parenting, the parents didn't like it because it felt that it was talking down to them or degrading them or not giving them credit for being parents. And I was like, wow, I didn't see that at all. So I think parenting is one of those tough, calling it parenting is the issue, and not strengthening or build. So that the big one is strengthening families is the one everybody's promoting right now, and that tends to have a little bit more substance abuse focus.
Yes.
But if people think about it, if we can get away from calling anything parenting, we would be more successful.
Yeah, no, I know. Even as I wrote that slide, I was like, oh, you know, I hate this. I was trying to think of what else to call it that would fit on there. But I think you're right. I mean, what we're trying to get away from is that your parenting is flawed, and focus more on, you know, I think, I mean, Tanya Hernandez one time said, you know, I need a new kind of parenting set of skills for this child, which I thought was a good way of putting it. Like, this child is I need some new skills for this child, and I thought that was a kind of a better way to put it. But yeah, we'll think of a better way to call that. Yeah, and I think I agree with you. Like, there's some kind of, you know, people need to think about not only the families that they're working with, but what they're comfortable delivering as well. Any other thoughts on this?
I know in our county they do a foundations, and it was actually a curriculum that was developed by the former family support person, and is foundations, building healthy families. And so that seems to work well for the families. But it's not evidence-based.
Right.
I've got a couple of curricula that we use for our parents with psychiatric disabilities program, which is a whole different kind of support. One of them is really old. It's from Arlene Brett Gordon, and it's called Families Facing Solutions. But the whole thrust of it is to try to keep parents who have mental illness themselves oriented toward recovery and planning, so that, you know, CPS doesn't swoop down and snatch up their kids and have them for lunch, you know. So that's a very nice curriculum for our worker to go in to the person's home. And then we found another one from Canada called Supporting Families with Parental Mental Illness. And that's a really nice one, too. It's very straightforward about what it's doing, which is to really try to focus on planning so that, and strengthening the parents' own view of themselves as parents, because a lot of parents who also have mental illness are buying into the whole stigma thing and drinking the Kool-Aid, you know, that I'm not worthy and I really can't do it and this is bad for my kid and all this. So those are a couple of really nice curriculums, and we also used for that program the wellness self-management that came out of OMH a few years ago.
Right, right. I think that's a really important area for us to take a close look at, because, you know, I would guess the number one thing we hear from people, well, there are two top things we hear from people when we ask them what's challenging, and one is parents with psychiatric disabilities, and the other is, you know, working with families where there are substance use issues. And, you know, that describes so many of the families that you all work with. You know. Any other ideas from people? This is great. Thank you. Okay. The next slide asks you to share with us what kind of involvement you've had so far with managed care organizations in your region. Sometimes these are known as the plans. Have you done any outreach? Has your agency been involved in conversations with the plans? Have you had any specific conversations around family support services? And what would be helpful to you as you think about that?
Boy, I'd really like a script.
Okay.
I'm serious. I'm serious.
No, I know you are. I know.
I have no idea how to approach them. None.
You're not the only one that feels that way. Trust me.
Oh, good, good. Glad to hear it.
You're not alone, trust me.
This is our third phone call of this type, and we get to this slide, there's silence every time. Everything else people have ideas about. This one is silent. So I think perhaps the first part of the answer to the question is to understand managed care and how managed care thinks. And then to think about, which we're working right now on a kind of, Seatac has done, or MCTAC has done a webinar on Managed Care 101 that caused me to take a deep breath about 4 slides in because it was so dense. So one of our partners in MCTAC, Boris Silgorin and I and Jerry and some other people are kind of going through that webinar now to, make it a little bit more accessible that we can do with family support providers. And start there, and obviously, you get 100 people on the phone and some of them think this is too easy and some think it's too hard, but at least sort of a foundation in managed care, like what is this all about? And then move from there on into the implications for family support, and from there into a conversation around what would managed care want to hear from you, and start that process a little bit. So, anything else on this? Okay. This next section really is about outreach, and some of you really operate within whatever system you currently operate. You get your referrals from SPO, or you get your referrals from, 1 or 2 places. And we're wondering what you are thinking about, or are you thinking about how you might need to change your outreach strategies both to families individually and to other providers that you may want to partner with, who might be referral sources for your program. Anybody been pondering this?
Yes, I am. I am going to a meeting in July with pediatricians at CVPH, so trying to partner with the pediatricians so I can educate them on my program.
Great.
Right.
One of the things we hope to bring to you in the form of some, webinars with other providers is to help you see some of the relationships that different provider organizations have that may be different from your own, so that you can explore whether those lines of work might be good for you. So, for example, we have, some people that have, different kinds of relationships with child welfare in their counties. Some people who are involved with medical practices, like Erica's talking about. And we're going to, the point here is to be thinking about, how this is going to look for you going forward, and to continue to diversify where you get funding from and where your families are referred from. All right, so you as family support program leaders, I'm interested in your top 3 list of, and I've heard many of these ideas already, and they are noted, and we'll put all this together in kind of a summary document that we'll share with you. What are the things that, we can do in the next 6 to 12 months that will really help you in your job as a program director? So what I've heard so far includes information on the changes with health homes and the waiver program, some information on managed care and guidance about how to have a conversation with managed care organization. I'm hearing about ultimately, and it may be a little further down the road, help with folks, help with how to guide your staff in writing notes, and doing planning around family goals that's acceptable in a Medicaid billing environment. What other things have we, and maybe there's a few other things here in my notes, what other things have we missed?
Well, again, I'm wondering about how do you sustain the services that won't be billable, like your support group and parent training classes and all the other things. I don't see those as being billable services. How will we support those?
Right. Okay.
Kind of like to know different examples of other counties, how they partnered with different agencies in their community.
Okay.
Not just partnering with them, but also so it'd be another funding stream.
Right.
Yes.
What are they paying you? What are they paying you to do? Right.
Yes, that's kind of where I need the.
Yeah. Well, and you'll hear with some of those people, you know, a challenge sometimes is to keep on mission, right? You know, so they might want to pay you to do something that isn't really what you do, right? And you have to go through the process with your board of deciding, is that appropriate for us as a family support program to do, or does it pull us too far off our mission? You know?
I've worked with many of a lot of the agencies and different programs in our community, but we don't get paid.
Right.
That's not a funding stream.
Yeah, right. So other thoughts on things that these are both good ideas. Other ideas of things that you really could use some help with? So for those of you who are smaller programs that may not have a lot of billing history, you know, really keep an eye on what MCTAC is doing around, you know, topics that you never thought you'd be listening to, like revenue cycle management and utilization management and contracting, and, you know, keep an eye on those resources because they will pertain to you, and at some point your organization will have to make a decision, you know, that's very grounded in whether you have the capacity to continue on your own, or do you need to merge with another organization in some way, or ally with other small providers to create a shared capacity to meet all of the infrastructure requirements of Medicaid managed care. So pay attention to those things, you know, by staying in touch with what's going on the MCTAC website. And signing up for that listserv, and really networking with other small providers that are in the same situation in your region. And there's something, actually, there's on June 11th, so that's Thursday in Syracuse, there is a day-long home and community-based services provider infrastructure workshop that MCTAC is putting on, and it happened in New York. I attended the New York City one about a month ago, and it's really helpful at walking through all of those details. I suspect that that will be repeated at some point in the future, but if you, if Thursday's a little close to be planning a trip to Syracuse, but something you might consider looking at. If your agency's already billing Medicaid and you're a large provider agency, that doesn't apply to you, but for smaller folks. So we'll try to keep, you know, what I'm trying to do is circulate information through the parent advisors and through Families Together listserv when I see things that are really important for folks to pay attention to, but do sign up for those websites as well. All right. So we pretty much covered all of these. These are the kinds of things that MCTAC and Seatac are going to help you with. And Jerry is going to talk about some of the things that are upcoming this summer in terms of Seatac and MCTAC offerings.
So one of the first things that's up and coming is the Children's Summit. I'm sure some of you have heard about that. There are going to be two that are going to be offered. One is going to be in New York City on June 29th. It's an all-day affair. And the other one is in Albany the following day, June 30th. And Ann is going to expound on that in a few minutes. And then we have the MCTAC managed care readiness, which would include readiness assessment, HCBS provider infrastructure training, revenue cycle management and utilization management trainings. There are contract series. There are also MCTAC and Seatac work with plans, which is the managed care organizations. There'll be a series of summer webinars with FPSS focus, and then some others that will be residential focused. And in the fall, we're planning some regional leadership events, as well as learning collaborative opportunities that are going to be happening, and some family peer advocate advisory group activities as well. So our next slide is something that I think, you know, with everything that's going on, one of the things that we need to try to do as much as possible is to keep calm and be open-minded, stay positive, and also know that Seatac is here to assist and support you in this transitioning process. We know it's not going to be easy, but we are definitely here for you, Seatac. Ann?
Thanks, Jerry.
You're welcome.
You know, I think that open-minded thing really is important. I know that the work that you do is really valuable, and the way you're doing it's working for you right now. And there is going to be some disruption to that, I think, but hopefully we can, you know, out of that, preserve as much as we can that's really working and try to find ways to do that. You know, kind of like I think Mary Ann talking about, how do you keep doing these groups? How do you make sure that you have funding to support that work? And I think the answer is going to be a number of different strategies, you know, not one. But also to think about other ways of providing support. And one of the great examples that I can think of like that is that there's an approach that Krista Kutash in Florida has used with schools called Parent Connectors, where she's got family advocates on the phone with parents, not as much as you would imagine, and demonstrating really great outcomes in terms of families feeling more supported around their kids' school issues, feeling like they were able to get more appropriate services for their children, school people feeling better about the relationship that they have with families, and it's all done by phone. And, you know, I think there would have been a time when I would have thought, you know, like, you can't really do this by phone. But it's something we need to look at, because if it's working and we can embrace it and it allows us to reach more families and it matches with the way Medicaid may be paying for services, I think we just need to keep an open mind about how we approach this work. And the summit is about many things broader than just family support, but I think that's basically the you know, theme of the summit. Let's think about a new way of approaching this work with kids and families, and really try to keep the vision in mind, even as we're dealing with all of these, you know, unpleasant details and disruptions along the way. And we're really hopeful that many of your organizations are choosing to come to the summit. Every agency is able to send 4 people to the summit, you know, if you're part of a larger organization, that may or may not include you. Hopefully it does include you. If it doesn't include you, you can check with us. If we have any additional spaces at the summit, we'd certainly be open to adding to the team. And if you're a smaller family support provider organization, you know, you're your own agency and you can send 4 people to the summit. In order to send people to the summit, you need to complete something called the Managed Care Readiness Assessment. Jerry, if you can advance that slide, that would be great. Thanks. Thanks. So there's a link here to the Managed Care Readiness Assessment. It takes a little bit of time to fill this out, but if you get a group of people together, it's doable. There's 2 parts. There's a child addendum and the main Managed Care Readiness Assessment. It's really actually a helpful list of things that you need to be thinking about. Do not be put off by the fact that your answers may be, I have no idea what this question is even asking, because that's really providing us with information about the level of technical assistance that you might need, and you will not be alone. So that has to be done before you're given a link to register for the summit. So there is a webinar online kind of walking you through the readiness assessment. You may be able to skip that part, but if your agency, I would really encourage you to participate in the summit, and this is the link to get you to the readiness assessment that you need to do first. Any questions from folks or other thoughts at this point? All right. Well, you know where we are. Here are the websites for Seatac and the Managed Care Technical Assistance Center. Do go on, check out what's there, and sign up for the listservs and take a look at some of the recordings from past events. There's nothing better than a MCTAC or Seatac recording on a Friday night with some popcorn. And these are actually, this is just a list of the upcoming future listening sessions. We have also heard from Central New York, and we're going to be listening to Western Region and New York City later this week. So thank you very much for taking the time to share your perspective with us. And if you have other thoughts, you know, here's our email addresses. You can add them to the conversation. And I just want to check to see if there's any other comments we didn't cover. Anna from Putnam Family and Service noted that they're also using Common Sense Parenting, but interested in other approaches. Okay.
All righty.
Thank you very much.
Yes.
I hope everyone has an enjoyable week.
Thanks.